In this segment, we discuss the different types of diabetes, how your body regulates blood sugar, and the harm that can be caused by having too much sugar in your blood. First, I'd like to illustrate the different types of diabetes. There are essentially 3 different types of diabetes, and all of them share some common characteristics, and all of them are different in certain ways. Okay? There's type 1 diabetes, there's type 2 diabetes, and then there's also gestational diabetes. Your body regulates blood sugar with 2 major organs. Number 1 is the pancreas, which helps manufacture and dump insulin into the system. And number 2 is with this larger kind of triangular organ on the right side of your body called the liver, which also manufactures and can dump glucose or sugar into the system. So your body gets sugar from 2 sources. Number 1 is, let's say in a 24-hour period, your liver dumps glucose into the system, and it dumps it in a pretty slow and gradual pace. Okay? Your body also gets glucose from the foods that you eat. So let's say, for example, breakfast is here, followed by lunch, and then followed by dinner. Okay? In order for your body to absorb the glucose or utilize the sugars that we eat and turn it into a source of fuel, you need insulin in order for your body to absorb that glucose. Okay? So insulin, which is manufactured and secreted by the pancreas, needs to be released in a proportionate manner to the foods that we eat and to kind of counteract what the liver produces in terms of that background glucose. The problem with type 1 diabetes is, well, first of all, type 1 diabetes is usually diagnosed in patients less than 25 years of age. Usually there's a family history of about 5%. And what happens there is the patient's pancreas goes through an autoimmune process which destroys its own ability to make any insulin at all. So for type 1 diabetic patients, they have to inject insulin for breakfast, lunch, and dinner. And not only that, they need to account for how many carbohydrates they're about to consume and inject the right proportion of insulin to cover for their meals. If they accidentally inject more insulin than what they eat, then what happens is they go into a condition called hypoglycemia or low blood sugar. If they inject too little insulin and eat more than expected, then what happens is they go into hyperglycemia, or basically there's just too much blood sugar in their bloodstream. So type 1s have to inject generally breakfast, lunch, and dinner, and then they also have to inject a long-acting insulin, usually at bedtime, but sometimes also in the morning, that lasts a total of 24 hours before it drops off again. So in general, type 1s are injecting once, twice, 3, and 4 times per day. Type 2s, on the other hand, have a slightly different problem. With type 2s, generally the pancreas is working just fine. The insulin is still being secreted from the pancreas. But there is a condition known as insulin resistance, or in other words, your body is not fully sensitive to the insulin that's there. So I'll give you an example. So as food, whether it be proteins, fats, or carbohydrates, enter your mouth, it breaks down by you chewing it, and then it goes down your esophagus, and it further breaks down in your stomachs. So all these complex carbohydrates, these fats, these proteins, start off as large molecules. They eventually break down and enter your body as your food breaks down through your digestive process and turns into simple sugar. Okay? The simple sugar from your intestines eventually seeps into your blood, and then your heart pumps that glucose, which is represented by these circles here, that's inside a blood vessel, and your heart pumps that through and to all of your vital organs. Okay? So let's say this is a vessel that is passing through your brain. Okay? As it passes through your brain, these squares represent brain cells, and we have thousands and thousands of brain cells. And you want to think of insulin as the key to unlocking these doors. Okay? It unlocks these doors and it lets glucose, or these, which is represented by these circles here, pass through. Okay? And as glucose enters your brain, that's what allows you to think. Okay, so our bodies need glucose, just like your car needs gasoline. It's a source of fuel for all of our vital organs. In other words, our brain needs glucose to think, our heart muscles need glucose to beat, our lungs need glucose to breathe, our muscle cells need glucose in order to move you around. Okay? So the problem with type 2 diabetes is not so much, or at least not initially, a lack of insulin secretion. In fact, your body is still pushing insulin into the system, but at the cellular level, meaning at this level right here, there's insulin resistance. Whether that be through excess adipose or fat tissue, whether it be through family history, which can contribute up to 40% in type 2 diabetes, these doors are not fully open. If the doors are not fully open, then now you have more sugar or glucose floating in the bloodstream. The problem with too much sugar in the bloodstream would be, or a good analogy would be like trying to push maple syrup through all your vessels. Maple syrup, as you know, it's very thick, it's very viscous, it's very sticky. And over time, it could damage your vessels. If it were to damage your vessels, it would damage your micro vessels first, or in other words, small vessels that supply blood to your eyes that allow you to see, vessels that supply blood to the kidneys that help filter waste, and vessels that supply blood to your lower extremities or your toes that allow you to have that sensation of feeling. Okay? If diabetes continues to be ignored and that maple syrup effect continues to build, then eventually over time, you might also suffer from large vessel damage. Vessels that supply blood to the heart, for example, vessels that supply blood to the brain that might cause a stroke or a heart attack. So the key is to managing your diabetes, to keeping the sugar in an adequate amount where your body can utilize it as a source of fuel, but not so much that it causes that maple syrup effect. And the last type of diabetes has to do with gestational diabetes, or in other words, insulin resistance that occurs when a woman is pregnant. When a woman is pregnant, there's a lot more active circulating hormones that cause insulin to be resistant, and that affects about 4% of all pregnancies. So in review, we've learned the different types of diabetes. We've learned how insulin and glucose work and help regulate blood sugar in your body. And we also have learned the harmful effects of having too much glucose in your system. Stay tuned for our next segment. Thank you.